How do I know I have OCD? Most people have weird, unwanted thoughts sometimes. Most people worry. So, how do you know when it's crossed a line into something more, like OCD? That's exactly what we're going to unpack today. Here's the key difference. With normal worry, the thought passes. You lock the door, you remember you locked it, and you move on. With OCD, you lock the door, and the doubt is still there. So you check again, and again, and even after checking, something still feels wrong. The certainty never comes. That's the cycle. An intrusive thought or fear triggers intense anxiety. You do something, a behavior or a mental ritual, to get relief. It works for a moment. Then the thought comes back, often stronger. The cycle repeats. Normal worry is proportional and temporary. OCD is persistent, exhausting, and feels impossible to control, even when you know the fear doesn't make logical sense. With normal worry, reassurance works. With OCD, reassurance is never enough. A few other things that set OCD apart. It takes up significant time, often an hour or more out of your day, and it genuinely gets in the way of your life. The thoughts are usually deeply distressing, not just annoying. Things like fears of harming somebody you love, contamination, religious guilt, or a need for things to feel just right, and they stick around no matter how hard you try to push them away. The relief from compulsions is always short-lived. Whether it's washing your hands, checking, seeking reassurance, or repeating something in your mind, the anxiety always comes back. If this sounds like what you're experiencing, you're not alone, and it is very treatable. Talk to a mental health professional who specializes in OCD. The most effective treatment is a therapy called ERP, Exposure and Response Prevention. It works, and it can genuinely change your life. Worrying doesn't make you weak. OCD doesn't mean you're broken. It just means your brain needs a little help, and that help exists. Remember that this video is not a diagnosis. Please subscribe for more OCD info here.